I remember some of the local reps would bring some of their friends and they come in. One guy got in a fight with his own friend. He goes, he's not a surgeon. There's no way you rep him. He's a freaking DJ. He's not a surgeon. That's kind of funny. That's exactly how I want it to be.
Hi, this is Polly from Vision Care Connect, and we are interviewing this evening for our series, Focus Through the Generations. We're in a really unique time right now in our industry where we have 4 generations of actively practicing ophthalmologists. So we wanted to take advantage of those generations and see what they have to say about each other, about the times, about our industry, and just about life. And we want to thank Bruder for being a supporter of this as well. And tonight we are so lucky to have Dr. Mitch Jackson with us. Thank you so much for joining us, Dr. Jackson.
Hey, Polly, great to be here.
You're always cool to talk to, so I'm expecting some great things here. And I'm going to give you an opportunity here, just introduce yourself. Tell us a little bit about yourself.
So, Mitch Jackson. I've been in private practice in the northern Chicagoland, aka Siberia, during the winter for 28 years. I'm going on my 29th year this coming June. I did my training at University of Chicago and met my first wife, had 3 kids, and opened a practice here solo, cold turkey, 29 years ago. Kind of done over 50,000 procedures now, and about to build a new building. We call it our Jedi dream, for Jackson and I. We got the Jedi culture. And it's exciting. I'm an anterior segment cataract refractive surgeon. And what else? My hobby, as you know, is DJ MJ. I do stuff for Live Nation for the last several years. Obviously, with COVID, nothing's been happening. Did a virtual program last year. It was kind of nice. Raised money for Gary Sinise Foundation. We raised money for Jason Menzo's Fight Blindness Foundation. The last live show I did in October of 2019 during AAO. So I try and keep it balanced life, stay fit, listen to music. And I always joke my OR is a modern day Woodstock experience for my patients. They get drugs, they get light show, they get music. What else could you want in your 10 to 15 minutes of glory, getting new eyesight? But Woodstock was 3 days. They always ask, can we get 3 days? I'm like, 10 to 15 minutes, all you got.
The difference is you leave your OR being able to see. You left Woodstock not being able to see for a few days.
Yeah. Probably we're pretty blind when you left Woodstock.
That's awesome. And your boys, you do a lot with your boys. I've seen you on Facebook and whatever. You're always out and about. Yeah,
well, 2 of my sons are professional esports players. I don't know if you know Aurora the Chunks, Might Pro, who plays for Team Radiance. They're the world champs from 2018. And they made it to Worlds the last 2 years and fell short. It's hard to repeat, in any professional sport.
Yeah.
And my other son, Laurelo, he's on Team Dignitas, plays League of Legends professionally. They're both celebrities. They come back home and everybody wants to sign their autographs. And
that's so cool.
DJ MJ, who? Dr. Jackson, who? But not
like
Laurelo and Aurora. They're famous, but they're doing great. My youngest son, he's a music guy, doing music and creates his own albums and doing his stuff and doing college stuff right now and remote learning. And so I'm happy they're doing great. And
I'm going to ask you a really cool question. If you could have lunch with anyone, dead or alive, who would it be and why? I love the expressions when we ask this question. Everybody's like, oh.
I'd like to have lunch with, because I'm a big fan, Batman. I have a 6'4" Batman at my bar. I'm all Batman freak. You've seen all that stuff. You've seen the Dark Knight stuff.
Which
it's kind of cool to have a live conversation lunch with the superhero himself, because I always say you haven't seen me and the Batman in the same room ever, just saying.
What is your most interesting patient case that stands out to you, whether it's funny one or your most interesting patient, a funny, memorable, sweet, whatever.
Oh God, I have so many stories. I've had one patient, obviously remain nameless, experience. I walked in really high myope, 20/20 the next day. I thought, God, she's gonna be so happy and hug me. Like, went from like completely ruined life can now probably do everything she wants in life. All she did, I walked in, she screamed at me, goes, "You made my hands bigger." Because you're really nearsighted, you correct it, you get a magnification effect. So I'm like, I didn't operate on your hands, but you know.
Let me
Yeah.
ask you a question. In hindsight, would you have done anything differently in your career path than what you've done now?
What I would like to have had the experience, I offer a refractive cataract surgery private practice fellowship. There's a bunch of us, Rob Weinstock, Bill Wiley, Ralph Chu, Stephen Bold, offer it. It's not, it's not university. And I knew I wasn't going to be in academics. And back when I came out in 93, there was only like cornea fellowships. There was no private practice refractive cataract surgery fellowship. I would have loved to have done that for a year, because what I would have learned, I would have probably saved a lot of mistakes and learning curves and got a better head start early on, over the years.
Refractive case.
What's that?
What was your first refractive surgery case?
I started my first, that's a good one. My first one was a PRK in November of 1995 on a malpractice attorney.
No.
First case. And I told him, I said, you're my first case. N equals 1. And he goes, why defend surgeons? So you're okay.
Wow.
I don't go after him. I go, all right, you'll be defending me against you, I guess. So he ended up perfect and still is to this day. And recently did a premium IOL on him, this many years later. So
brave. I think most people would have said, you know what? I've got a great doc for you down the street. Let me give you his number.
Yeah. So I was one of the few, few of the ones early on. There's a picture with me, like with Dan Dury and Perry Binder and Vance Thompson and Mario McDonald. I'm like the young whippersnapper in the picture. Is an Alcon picture, first generation laser vision correction, called the pioneers of laser vision correction. My little young face was in the group, and they started really young with all this. It was kind of cool. Peter Hirsch. I'm trying to think. There are a lot of cool people in that picture. Dick Lindstrom.
I think Mona's Preface in that picture.
Manis was in that one. So we were all down at Alcon. I was probably definitely the youngest.
Yeah.
And so I kind of, it's a good memory. So I started early with it. So, that's kind of how I got into, that kind of was like what paved my way in the refractive cataract world. Was and then I trained all these docs on the Moria microkeratome, at least 800 surgeons worldwide. I was their lead instructor for that. So between that and Alcon with the lasers and everything early on, the refractive industry is what kind of made me who I was.
Yeah.
And then kind of with time became more cataract, involved. And I have a monthly column I write for OSN, Ocular Surgeon News, and Helio.com. And I just wrote and submitted last time my 85th monthly column.
Really?
So, I called it Dawn of the Dead, the critters, trying to keep the critters away from the ocular surface. Dawn of the Dead for dry eye disease, kind of fun. My one last month here, I'll read it. Let's see, my one that just came out last month was Drip Drop, TikTok, or Presbyopia Drops, Turning Back the Clock. So that was my last. I have to come up with a new one every month. It's not easy. 85. So I'm going to go to 100. I talked to, the guys, Dave Mullen and all of them over at OSN. I told them I get to 100, that's it. And then my 100th issue is going to be I'm going to pick, I always do my annual top 10 picks of the year, what happened that year. So I'm going to do my top 10 columns when I hit my 100.
I like that.
So that's going to be, so that'll be a nice cover, kind of. I'm going to close it out on number 100. Yeah, I still have to go 15 more.
Wow. You know, I worked for OSN. I helped them launch their Asia and India papers.
Nice.
Yeah.
Yeah. I forget, when did I meet you again, Polly? I
With
know
Mark,
you. What's that?
with Marco, when you put in the
Oh yeah, with Marco. Yeah, it's like the OPD. Didn't I do the OPP? It's OPD. Come on, everybody, buy an OPD,
there you
not
go.
OPP.
But I go back to the Epic days.
Oh yeah, oh Epic was like the first. I still have my first Epic from 1994. I think I
Yeah,
had.
I was in your practice. Yeah.
You
Yeah.
were in there. Yeah, I still have the original. I'm buying 3 more for my new building when it gets built.
Yeah, I was working with Kathy Rafati at the time. We were doing the
Yeah,
process.
Kathy was just in the other day. I
She's
saw
awesome.
her. She was in. She's doing a bunch of other stuff, but I still see her all the time.
I love Kathy.
She's
Um,
awesome.
you know what? There's so many good people in this industry, and I've been so lucky to work with so many of them. So I'm
Like a
really.
small world, it's a small world.
I said,
Tell
you
them
know,
like that, you never leave. If you leave the I world, they always come back.
you can't leave.
You
It's
can't
I said
leave. You try and leave, it's way worse on the other side.
I said we are the most incestuous industry ever. It's like you try to walk out, but you can't because you don't fit anywhere else anymore.
You
You just
don't fit anywhere else. They look at you like, you're not doctors. What the hell are you?
yeah, you don't fit. You don't fit. Something's
You're
wrong.
not robotic. You have personalities. What's wrong with you?
I want to know what did people say to you the first time that you got up on the stage and did your DJ MJ for the ophthalmology group?
Well, so I've done like 33 shows at the Foundation Room, the Chicago House of Blues. And I remember some of the local reps would bring some of their friends and they come in. One guy got in a fight with his own friend. He goes, he's not a surgeon. There's no way you rep him. He's a freaking DJ. He's not a surgeon. That's kind of funny. That's exactly how I want it to be. But I have a 16-man crew now, and I did a big show in honor of my younger brother who passed. 2018 was a rough year. I did a big show, Celebrate Life. Remember in Navy Pier?
Yeah, I do.
With the Ferris wheel thing and all that. It was pretty. That was my favorite. If you ask what my favorite DJ show, Celebrate Life, which, not knowing the pandemic was coming, was the perfect theme back then.
It was.
Just that show was pretty crazy, and everybody from my family came, my sons, everybody from Chicagoland, from California. It was almost like 7,000-8,000 people on there in Navy Pier at the height of that night.
You're in a zone when you're up there, man. You are so in a zone. It's crazy.
It's fun. Quentin Allen, DJ IQ, he's an eye surgeon, now in Florida. He's my buddy. Past president like me of Cedars Aspens. So it's another group I'm proud of. And I don't know, everything. I think of all the things that I'm president-elect in 2 years to follow Cynthia Potosi and Denise Vispa just finished for ACES, American College of Eye Surgeons, founding member of ACOS.
Yeah.
I'm on the refractive cataract subcommittee of Ascaris. I'm part of the POC panel for AAO. Do my monthly column on the editorial boards of CRST, OSN, Advanced Ocular Care. What's a few others? I can't remember them all now.
Wow. How do you find time to practice, Mitch?
Well, I just do it every day. I usually shut off the switch, hopefully I didn't really get to watch as many like the Netflix shows. I did a little bit during quarantine, but I didn't really get to watch many because my whole life I'm always doing something.
You are. Let me ask you a question. What did you learn during COVID that you're going to take forward? What are you doing different in your practice during COVID that you're going to take forward post-COVID, if we get to post-COVID?
We do like everybody else. We kind of, it's hard because my practice spacing is small. And I was really busy before, so it's hard to get that many people in the practice when I have my new building, hopefully to break ground this summer and be in it by next summer, 2022, hopefully. So we're redesigning the whole building to be pandemic proof too. So we're even putting it in the filtration system, the HEPA filter system for stuff. And we're changing everything. Will be all designed to be COVID or other pandemic friendly. situations. But so I guess we're learning before at least I guess it's a good thing. I guess I'm getting a low interest rate for my new building. So it brought a low interest rate for me. That's good. But we're learning how we're going to design the new building. We're changing things for originally what we're going to do before I derailed my whole project. But in a way, it's a good thing. It's good that I didn't build it in the middle of it. That would have been bad.
It is. That's awesome. Well, I have one more question for you, and then I'm going to let you go enjoy your night, what's left of it for you. But you've been in this industry quite a while. So how have you seen technology in ophthalmology transition since you've been in the industry? What are your predictions for technology in the next 10 to 15 years in this industry?
So let's start. This is a good thing to end because the reason why I became an ophthalmologist, back in, my dad's now passed, but he would have been about 85. So when he was 8 years old, 78 years ago, he was living in Scotland outside of Glasgow. And him and his friends, there was a bacterial meningitis outbreak. Back then, they had no antibiotics. So 7 of his best friends at age 8, imagine this happening, all passed.
Wow.
One went deaf, and my dad lost sight in his one eye and partially sight in the other eye. And he went on to become a well-known attorney in Southern California and lived his whole life, raised his 3 kids and got me to where I had to be and did everything in life. So I wanted to become an ophthalmologist to figure out a way to fix his eyes, and kind of that's why I do a lot of clinical research. So he had an optic neuritis from the bacterial meningitis. But that's why I became so technology-wise. I mean, that's why I've been involved in at least 40 to 50 clinical trials, been medical monitor in many. I'm global medical director for a presbyopia study right now outside the US for a laser scleral treatment. I've been involved in presbyopia eye drops and lens implants and all these so many dry eye studies and a lot of things. It's kind of nice to see everything that I use now, I was part of in the past. So we got like 6 studies we're in right now and still keeping going on that. But the future, I mean, how it's changed. I remember starting cataract surgery back at residency, probably, the extra cap days. I even did few intracaps, believe it or not.
Wow.
Patients would take at least a month to 6 months to get what they see in one day now. I tell patients that. So I should feel lucky because what you do in one day, when I started, it took us 6 months. Sometimes you get patients where you're at in one day. And I think in the future, I don't think there'll be any eye surgeons. Everything.
No, don't say that.
It'll be Terminator land. No.
Then I have no job, so let's not talk about that.
No, I know. I think really technology is going to evolve where there will be kind of no true healing responses. Like we'll be able to put a lens in that will be perfect. We already got like light adjustable lens as a start of that, but still a lot more visits and things you got to do. But the whole goal is to achieve perfection for that patient. So I think everything's going to be customized for the future, even be safer, faster healing. Presbyopia, dry eye, glaucoma, macular degeneration are probably the 4 big ones.
Yeah.
In my opinion, be able to see patients with macular degeneration where, we do injections now, which was a big step, but it'd be nice to see all these dry AMD patients get some medicine and see again.
Yep.
That's the future. They already got gene therapy for these inherited retinal disorders. IOLs are going to be, refractive shape indexing and other things, true accommodating IOLs. That's all the future. There's going to be more beyond that, I'm sure. Already with presbyopia drops will be a nice bridge to that. There's a lot of those companies coming out now. Dry eye, look how many. There's like already, it was just Restasis for 13 years.
It was.
And all of a sudden, we got like from one thing to like, not just pharma, but thermal pulsation devices. And God knows that we have like 35 different treatment options for dry eye now, or ocular surface disease, and a lot more on the horizon. It's just going to keep getting better.
Yeah.
Automation is going to be a big thing for all of us, even as surgeons. Automation, learning curve. We want to reduce the learning curve and get the training for young ophthalmologists better, and getting our young ophthalmologists trained. Things like we're doing the refractive cataract fellowships is kind of one of the things outside of traditional university programs. I think is good for those who want to go into private practice. It's a good learning. Like I said, I wish I had that opportunity.
I think the generations coming are going to have more business acumen than what we've seen, what we had coming out, because
Yeah.
we were doctors and we know there was a business
Right.
of being
Right.
I'm going to ask you a question. You were mentioning dry eye. You use Bruder, right? The Bruder
Yeah,
mask.
I use Bruder. I love Bruder.
Yeah.
Great technology.
And it's fun to watch. I use it myself. I use more the big sinus thing. I love the sinus one. It's like heaven.
Right.
Having a bad day. But
yeah, look, they even have it right on my desk. They got their
no, you don't.
Pre-surgical kit
You.
sitting right on my desk.
Stan's gonna grab you and hug you next time he sees you.
Yeah, pre-surgical kits. We just started to implement it. We have to kind of order a bunch more. We got to get going, but that's kind of my optometrist in my practice, 25 years experience, Dr. Bollinger. She's awesome. Brought her in a couple of years ago, and she's made a world of a difference. And she's kind of running our dry eye spa.
Right.
And when we have our new building, we're going to add a couple more specialists and have a aesthetic spa. We're going to be doing IOR, in-office cataract surgery.
Wow, you are.
Yeah.
That's great.
Yeah.
Oh, I can't wait to see. Well, listen.
Kind of the future. Everything's moving that way.
You're going to be there. You'll be one of the first. You'll be out there, and then you'll be mentoring all these ones coming up, just like you got mentored. You'll be grabbing them in and bringing them here.
It's nice where I'm on my third fellow, so nice to have hopefully a little legacy when I'm finally done.
I love that. I love
little
it.
I call them the Jedi Masters. They're out there.
They don't call you what is it? What do they call the Darth Vader thing? What is it?
No.
No.
We call ourselves Jedis.
Yeah.
For Jackson I in our practice.
You give them swords, when you.
Yeah. So I just call them a Jedi Master. I always call them that, like near the end of the year when they're operating, when they are talking through the whole case, and they go, "Oh shit, I shouldn't have talked through the whole case, Doc." I'm like, "No, you've now become a Jedi Master because you actually did the whole case without thinking about what you were doing. You actually just did it. So now you are officially ready for the real world."
You graduated. All right.
Yeah.
Dr. Jackson, thank you so much for joining us this evening. You are always awesome to talk to, and I appreciate you promoting this and doing what you're doing, and just keep throwing those our way, and we'll be looking to you for our next segment also.
Remember, celebrate life. That's my motto.